Seorang penghuni kos di Tanjung Duren ditemukan tewas diduga akibat komplikasi asam lambung.
Stomach problems are among the most frequent health issues that affect people of all ages worldwide. Stomach problems are common health issues that affect many people and include conditions such as gastritis, acid reflux, indication, and infection like gastroenteritis. Symptoms often involve stomach pain, nausea, bloating, and change in bowel habits. Causes vary from infection and dietary factory to chronic disease like irritable bowel syndromes and ulcer. Most stomach problems can be managed with lifestyle change and medication, but early diagnosis is important to prevent complications and improve well-being.
Hello everyone, today we will talk about antacids. Antacids are a type of medication that works to neutralize excess stomach acid. When stomach acid is too high, we may experience symptoms such as heartburn, a burning sensation in the chest, nausea, or bloating. Antacids work by reducing this acidity so the symptoms can lessen and you feel more comfortable.
So, antacids are like medication that neutralize stomach acid, right?
Exactly. Antacid usually contain substances like magnesium hydroxide, aluminum hydroxide, or sodium bicarbonate that react with stomach acid and turn it into a more neutral substance that doesn't irritate the stomach.
Can antacid be used by everyone?
Generally, antacid can be used by adults and children according to recommended dosage. However, for pregnant or breastfeeding women, it's best to consult a doctor first because some types of antacid should be avoided in certain conditions.
So, when is the right time to take antacid?
Antacids are most effective when taken at the onset of acid reflux symptoms. For example, when your stomach feels sore or burning. Usually, antacids are taken about 1 until 2 hours after meals or before bedtime. This is because after eating, the stomach pH rises slightly and antacids help neutralize the excess acid.
What if I'm taking other medication? How should I take in antacids so they don't interfere?
This is important because antacids are alkaline. If taken together with other medication, they can reduce the absorption of those drugs. So, leave a gap of at least 1 until 2 hours between taking antacid and other medicines, especially antibiotic or drugs sensitive to stomach pH change.
Can I take antacid anytime if symptoms come back?
You can, but don't overdo it. Use antacid according to the dosage instruction on the package or your doctor's prescription. Excessive use can cause side effects.
Besides taking antacid, are there other ways to reduce acid reflux symptoms?
Definitely. Here are some practical tips that can help reduce acid reflux symptoms. One is avoid food that trigger acid reflux such as spicy, acidic, fatty foods, and caffeinated or alcoholic drinks. 2. Eat smaller, more frequent meals instead of large portions. 3. Don't lie down immediately after eating. 4. Maintain a healthy weight because excess weight increases pressure on the stomach. Reduce stress because stress can also increase acid production. Last is sleep with your head elevated to prevent acid from rising into the esophagus.
Are antacids safe to use? What are the possible side effects?
Generally, antacids are safe if used as directed. However, excessive or long-term use can cause some side effects such as diarrhea, especially if the antacid contains magnesium hydroxide, constipation if it contains aluminum hydroxide, and electrolyte imbalance if used continuously, and the last is mild nausea, vomiting, or stomach pain can also occur. If you experience unusual side effects or worsening symptoms, consult your doctor or pharmacist immediately. So friends, antacids are effective effective medicines to neutralize excess stomach acid and relieve symptoms like heartburn, nausea, and burning sensation. Use antacid as directed, leave a gap when taking other medicines, and adopt a healthy lifestyle to prevent acid reflux from recurring.
Thank you so much. Your explanation was very thorough and clear. Yes, now I understand when and how to use antacid properly.
You're welcome. Don't hesitate to ask your pharmacist or doctor if you have any complaint or want to know more about medication. Stay healthy and comfortable.